And I call the member for Cunningham.
Thank you, Deputy Speaker. Deputy Speaker, just to indicate to the House that I rise to support the amendment moved by the Shadow Minister. The bill before us, of course, is the Health Insurance Approved Pathology Specimen Collection Centres Tax Act 2000 amendment. It's intended to change the frequency of the tax paid by approved pathology collection centres, known as ACCs. At present, each of Australia's 5,500 to 6,000 ACCs pay a tax of $1,000 when approved, and that has to be renewed each year. Under this bill, they'll pay a tax of $2,000 every 2 years instead. As an intention of the bill is to reduce the regulatory burden for government and industry, but to maintain the revenue raised from the tax. Of course, the bill sits within, as the Shadow Minister outlined, a range of developments that have occurred since the 2015-16 MyEFO. At that time, the government sought to cut $650 million from Medicare bulk billing incentives for pathology and diagnostic imaging, including abolishing incentives for pathology. The peak body, Pathology Australia, commenced a serious and major campaign against those cuts. It was called the Don't Kill Bulk Bill campaign. That particular campaign included a petition which attracted over 600,000 signatures. So as a result of this campaign, during the 2016 election campaign, the government reached a settlement with Pathology Australia, and pathologists accepted the abolition of bulk billing incentives in exchange for a re-regulation of the rents that pathologists pay to GPs to co-locate in their practices. However, GP opposition to the changes forced the government to break that deal in the 2017 budget. This bill is one of a number of policy changes that the government has offered to the pathology sector in return, and so the amendment moved by the Shadow Minister reflects the problems that have led to this position, whilst not denying the bill a second reading. I just want to touch on, in speaking to this bill and the health insurance industry, some of the concerns that have been raised by my local constituents. In February this year, I did one of my cost of living surveys and had over 1,000 locals respond to that survey. Over 80% of them indicated that they'd had no real increase or indeed a reduction in their pay over the last 3 years. 45% of them said that their doctors and specialist visits put increased pressure on their budgets. 33% said pharmaceuticals put an increased pressure on their family budget, and 67% said that the private health insurance costs put increased pressure on the family budget. Of those who responded, over 70% of people said they found it difficult to make their income stretch over their pay week or fortnight or month. Over 70% are struggling with the cost of living, and a significant proportion of those indicated that health costs were an important contributor to that struggle. And over 70% of those who responded felt that private health insurance was not good value. Just repeat that, over 70%, over 1,000 people just in my electorate who indicated that they did not feel they were getting good value for money with their private health insurance. Not only did they respond to the question, but I invited people in an open section of the survey to make comments on what their experience was and why this was an issue for them. And I want to share some of those because they go to the very issues that have led in the health insurance debate and the issues that have led to this bill. They reflect very much the experience of locals in this space. I'll just use people's first names because to give them some respect of their privacy, but the response was enormous. There was almost none of the surveys that I received back where people didn't take the opportunity to give me some direct written feedback of what their experience in health insurance has been. Scott from Bulli said, "I can't see value in it. I feel like it's a scam and gap fees to pay every time." Nathan from Warrawong, "Value for money is not good and getting worse." An anonymous contributor from Coaldale, "We don't have health insurance because we cannot afford it. We just hope we don't get badly sick, for example, need elective surgery, because we are reliant on the public health system. We hope perhaps we can afford insurance when we are older and have a higher income. I'm now over 30 and it will cost more and more every year I delay." Tian Bing says, "It's too expensive and I cannot get much help." Emma said, "Recent articles stating that it isn't value for money and I'm probably better off just supporting the public system. I also don't like the rebate." Barry from Stanwell Tops, "Of no benefit as after paying exorbitant fees we still have to pay a $500 excess and then pay for each specialist over what is covered by the fund, when as a public patient we would not have any of these costs. Does not make any sense to pay to be ripped off." Natalie from Wollongong, "The cost for full cover is astronomical, even if you shop around and find one that best suits your needs. I would love to be able to cancel mine, but I have serious health issues that require my hospitalisation multiple times each year." Ross from Corrimal, "The cost has risen so far that, with also having to pay for the gap, there is no value for money." Hayley from East Corrimal, "We don't see the point in it. We pay way more than we use for benefits." Maria from Warrawong, "Don't have it, cannot afford it." Helen from Farnborough Heights, "Considering my wife has to have hip replaced, the specialist gap is $3,150. Also had to pay another $400 gap for the anaesthetist, plus anything else that might crop up." Stu from Tarul, "We can't afford to use the service that we get minor deductions on. Even the out-of-pocket costs for dentistry is such that we avoid going." Lois from Ostomy, "It's very expensive. 74 and fear age-related illnesses, though am presently in good health, but require dental and optical, which are poorly covered by my private health insurance." Sue from Woonona, "We always end up with big gap payments. The rebate on extras like dentists and optical are ridiculous." Janine from Corrimal, "The only benefit of insurance is for urgent electives, that is endometriosis, hernias, most other debilitating health issues that are not deemed life-threatening, but you cannot wait for months or years to be treated. But the out-of-pocket can break you financially." Mark from Mount Pleasant, "The out-of-pocket expenses for some procedures and the ever-rising costs make the product a bad deal." Alan from Helensburgh, "Poor value and gap difference far too high on specialists and private hospital." Mark from Unanderra, "There is about to be another price hike and we get no value for money. I will change it to necessities only. I pay way too much for healthcare. It is very disappointing." Catherine from Figtree, "It costs our family nearly $300 a month for hospital and extras cover. The extras cover goes towards necessary healthcare, dentist, optical and physiotherapy to keep us well and functional. However, the amount paid out by insurers against those premiums is pitiful, and often a couple of extra visits to a physio for an injury will be the difference between making it from pay to pay with some money left in the bank and having to use our credit card to cover necessary costs like groceries, etc. Since we are generally healthy, we rarely use the hospital cover. However, we are scared to drop the cover because of the penalties imposed under the tax system and by the lifetime health cover penalty should we want to take up cover later in life. Private health cover is terrible value for money. We never receive the full amount back for services. We would drop our cover and rely on the public system, except that we want choice when we are older. So we are paying now so that in 30 years' time, should we need specialist care in the private system, we're not penalised for having not held private health insurance across the lifespan." Mark says we don't have private health insurance because it's unaffordable. Also, we don't see any real benefit in having it. Leslie from Ostomy, when I retire, it will cost $100 per week, which is almost half the pension. David from Wollongong, I'm finding it too expensive, going up more and more every year, but the benefit I get from it is going down and backwards. Michelle from Belambry, we are considering to cancel the extras and pop the money in the bank instead. We're not getting value for money as the gap on items seems to be getting bigger and bigger. And Colin from Stanwell Tops, pay nearly $4,000 a year and still have to pay out of pocket. Been paying for 50 years. And this is just a small sample of all of those who replied to my survey. So when we talk about health insurance and the private health insurance system, we have to recognise that while profits are up each year for the private health insurance industry, the latest official data showing that they were getting 3.7 billion more than they were paying out in benefits, there are many, many people in our community who feel increasingly that it's not only not good value for money, but they're very, very frustrated by the fact that they feel they can't give it up, but they're not getting a fair go under what they get back. And as many of those commenters from my survey said, the premiums continue to rise while the benefits don't seem to be improving at all. I think it is important to acknowledge within this health insurance debate that Labor has made it clear that we want to tackle this problem. It's very important that we realise this is a real cost of living pressure on families, and it's no wonder that many of them, as reflected by my constituents, are considering actually dropping their cover. Indeed, nearly 12,000 people dropped their hospital insurance in the last 3 months of last year. And so it is something that needs serious attention. This is why Labor has said that we will cap premium price increases at 2% for 2 years, which will deliver families an average saving of $340 and shift the balance of power back in favour of consumers rather than these private insurance companies. But as part of that, we will also task the Productivity Commission with a sweeping review to identify long-term sustainable ways to bring down costs and improve quality. And so as we debate this bill today, another in a range of bills dealing with health insurance, the private health insurance industry, I think it is very important to listen to the voices of the people in our community, and I'm sure colleagues not only on this side but right across the House will have heard this when you talk to your local communities, that people are finding carrying the cost of their private health insurance increasingly problematic. They've had stagnant wages, their cost of living keeps going up, and when the cost of health is going up as well, as many of those comments I've just read out indicate, people sadly in some cases don't follow through on their health purchasing pharmaceuticals, having pathology tests, going to see the specialists as they were required, and that has very serious health implications. But also people are doing those things, paying those costs, and then not having money for groceries or putting things on the credit card that they shouldn't be, and so getting themselves in more financial difficulty. So I do think that it is very, very important that we understand that health insurance, not only as in this bill as it affects providers such as pathology providers, but across the board have real implications for real families in our communities, and government needs to get serious on getting much more effective action on addressing those costs and the gap between what people are paying and the services that they feel they're reasonably receiving. And so I commend the amendment moved by the Shadow Minister, and I think it is very pertinent to the health insurance debate that we acknowledge that context within which we debate it tonight. Thank the House.